Okay, so in this video, I'm going to talk about what a heart attack is. Clinically, a heart attack is known as a myocardial infarction, but I'm just going to try to explain as quickly and as simply as possible what a heart attack is. Before we start talking about that, though, I want to point out a couple of important pieces of anatomy. The first one is this very, very big blood vessel called the aorta. Very large, very important blood vessel in the body, and it comes right off the heart. And it's going to deliver blood to the organs of the body. Now, at the base, at the very start of the aorta, we have a couple of very important vessels that branch off of the aorta, and they are called the coronary arteries. Now, the coronary arteries, these are going to be the focus when we talk about the heart attack. Because what a heart attack is, if we just take this, piece of this artery and kind of blow it up, what a heart attack is it's a blockage of one of these coronary arteries. And of course, that can be very dangerous because when you have a blockage in one of these arteries, you cut off blood supply to the muscle of the heart, and the muscle of the heart is what allows the heart to pump. Okay, so I'm going to take this just little vessel and I'm going to kind of blow it up. I'm going to make it look kind of like a little pipe here. Okay. So this is our coronary artery. And most cases of heart attack are actually due to plaques within these coronary arteries that have ruptured. And a lot of people think that these plaques kind of build up on the inside of this vessel, which isn't true. The inside of the vessel here, this is known as the lumen, so the lumen is the portion that the blood flows through. But really, these plaques are actually building up within the wall itself, okay, so kind of in here. And what can happen is these plaques can kind of start to cut off blood supply. Okay, so if you've ever heard of anybody talking about angina, a lot of cases of angina, chest pain, are due to this lack of blood flow. Okay, now, if these plaques rupture, that can cause a big problem because that can completely stop blood flow. And that's really what a heart attack is, when you completely stop blood flow to a portion of the heart muscle. And that's kind of what's being shown down here. So this is a relatively minor obstruction, but basically you have this little, it could be a blood clot that is formed because of this plaque. It could be a number of things, but basically blood flow has been cut off to an area of the heart muscle. Now, if you have a blockage way up here, that's much more dangerous than a blockage down here because you are cutting off blood flow to a larger portion of the heart. The problem with the lack of blood flow, obviously that's bad because the heart muscle is not getting oxygen, but what happens is the cells start to die. And when the cells start to die, that's what's meant down here by necrosis. When the cells start to die, they can't communicate with each other, and communication between the cells of the heart is vitally important. If they can't communicate with each other, they can't pump effectively, and that's when a heart attack can turn deadly.